A Better Brain Neurotherapy Center uses a non-invasive, painless, and drugless approach to treat ADHD.
Sounds really interesting. Joining us is founder and owner, Dr. Jason Richards, who will explain how this all works. Thank you so much for joining us.
Yeah,
we were just saying that, you know, for many years, people were turning to medicine to solve a lot of problems. But now we're sort of more seeking a organic approach, more wellness. That's what you're talking about, too.
Absolutely. Yeah, the trend is to stay away from medication, stay away from surgery, do something more natural. And neurofeedback fits right into this. Neurofeedback, also called neurotherapy, it's a type of biofeedback, but it uses basically sensors on the scalp that detects the brainwaves. And through feedback mechanisms, operant conditioning, we can actually make changes to those brainwaves and come to a more normalized pattern. So conditions like ADHD, migraines, depression, anxiety, all of those have been shown to have abnormal brainwave patterns, and those are measured through a process called QEEG, or quantum electroencephalogram, and then that can be analyzed and create a map of the brain. And basically it shows different parts of the brain fire different types of brain waves, and when those are abnormal, they typically correlate with those types of conditions.
So we're looking at some pictures now. This is part of the program.
Yes, this is an example of a cap that's placed on the scalp for the QEEG, and takes a few minutes of the child there just watching a movie while they're quiet, and it records the brain waves, and then a map is created from that.
So it's not scary, it's somewhat relaxing for them.
Exactly.
Any parent could tell them that, it's no big deal.
Yeah, there's nothing going into the brain at all. It's just reading it, kind of like an electroencephalogram or EKG for the heart, reading the heart waves, basically. It's just reading the brain waves.
It seems like such a great option that you don't have to use any sort of drugs or something that's not natural. Right. Talk to us a little bit about your program. It's 12 weeks long.
Yep, it's a 12-week program minimum. Up there you see the sample of a brain map, and that just shows the different portions of the brain waves and the distribution of it throughout the scalp. Now, the home program training is done primarily in the home, once a week in the office to monitor it, but these changes are permanent, and there was a picture earlier of the wires on the head, the sensors on the scalp, and so it's something that's very easy that parents can set up and do at home. And little by little, things change. I also have a social worker in the office that meets with the parents, meets with the child, and helps with that aspect of it as well, so that we make sure that everything is addressed with the child with ADHD, and that progress is being made.
We hear about it a lot these days, so that's really making a difference for kids' futures if they can get a handle on some of these behaviors.
Absolutely, and to be medication-free permanently, that's a big thing too, because these changes are permanent. It's been shown that after training, those changes stay with you, so that you don't have to go back to medication.
Who would be the ideal patient for this?
Anyone generally between ages 7 and up, 7 and teenage years, even adults can do it. But typically it's the parents that see the child or hear reports from school about children not being able to sit still in their seat, they're disruptive, they have outbursts, they're wiggly, or they daydream. They're kind of unfocused and can't seem to concentrate on what the teacher's been saying, or they can't follow directions. If you tell them, go up to your room, you need to clean up your room, and then you need to empty the trash, and then you need to walk the dog. And pretty soon you find them up in the room on their computer.
Sure.
They need to be able to sequence events, and that's just a sign that is not happening.
Good. Doctor, just give us your website.
Sure, it's abetterbrain.com.
Very good. Thank you so much.